Hello, everyone. We are continuing our conversation in Chapter 13 on resistance training. This is part 2. We're going into more of the application and technique stuff. So there are several different hand grip types used in various exercises and sports. The choice of hand grip depends on the activity, the equipment being used, and the desired training effect. Here's some common hand grip types. First, there's the closed grip. This is the most common grip type where the fingers wrap around an object or handle, providing a secure and firm grip. It's used in exercises like pull-ups, rows, and bicep curls. The pronated grip, which you see, this is A here in the picture. And a pronated grip, the palms face down and the fingers wrap around the object with the thumbs on the opposite side. This grip is used in exercises like overhand pull-ups and barbell rows. The supinated grip, the palms are face up and the fingers wrap around the object with the thumbs on the opposite side. This grip is used in exercises like an underhanded pull-up, a bicep curl, and chin-ups. A neutral grip is when the palms face each other and the fingers wrap around the object with the thumbs on the same side. This grip is commonly used in exercises like neutral grip pull-ups or hammer curls and neutral grip dumbbell presses. You don't see a picture of that up here necessarily, but the hook grip is commonly used in weightlifting exercises, such as the clean and snatch. In this grip, the thumb is wrapped around the bar first, and the fingers are wrapped over the thumb and bar. This grip helps secure the bar and prevents it from slipping out of the hands. Now, a false grip is used in gymnastics and certain exercises like muscle pull-ups and ring work. In this grip, the thumb is not wrapped around the bar or rings, which allows for a deeper wrist position and more efficient movement. You might also use a false grip with someone who has high blood pressure to keep them from increasing their blood pressure. An open hand grip is another means. It's used in exercise where secure grip is not necessary, such as with kettlebell swings or grip strengthening exercises. And this grip, the fingers are extended and the object is held using the fingertips and palm without wrapping the fingers around it. It's important to note that the different grip types can target different muscle groups and provide variations in the training stimulus. It's advisable to use proper form and grip technique to ensure safety and maximize the effectiveness of the exercises. Another one that isn't necessarily discussed here is the alternated grip. And one hand is pronated and the other is supinated. This is one that's used with deadlifting, but it's also used when you are doing some spotting work. There's a difference between when performing exercise involved grip and the width of your grip can have an impact on muscle recruitment, joint stress, and exercise effectiveness. The optimal grip width can vary depending on the specific exercise and individual factors such as body proportions. Oftentimes, if you are wanting to work like bodybuilders, they want to have a wide grip to incorporate more musculature. Fundamental technique guidelines for the starting position can vary depending on the exercise you are performing. Standing exercises refer to exercises that are performed in an upright position, typically with your feet on the ground and your body weight supported by your legs and the core. This exercises engage multiple muscle groups and require stability and balance. Typically, your feet are shoulder width apart and your knees are slightly bent. When using resistance training machines, it's important to maintain proper form and technique to ensure safety and maximize the effectiveness of the exercise. Here are some fundamental technique guidelines for using machines particularly. You want to properly adjust the machine to suit your body size and range of motion. Make sure the seat height, backrest position, and any other adjustable components are set correctly for your client's comfort and alignment. And maintaining proper posture, you're either sitting or standing with good posture throughout the exercise. Keep the shoulders down and relaxed, chest up, and core engaged. You want to be careful about having your client avoiding any slouching or rounding of the back. Use the machine's built-in supports or handles to stabilize their body during the exercise. This ensures that the targeted muscles are doing the work and reducing the risk of injury. You always want to start out with a light weight, begin with a lighter weight or resistance setting to familiarize themselves with the machine and the movement pattern. Gradually increase the resistance as they become more comfortable and confident. Focus on controlling the movement throughout the entire range of motion. Avoid any using momentum or jerking motions to move the weight. Perform the exercise in a slow and controlled manner and emphasize the muscle contraction. Each machine is designed to follow a specific path of movement. Make sure to follow that path and avoid any excessive or unnatural movements. This helps target the intended muscles and reduce the risk of injury. Remember to breathe throughout the exercise, having them inhale before initiating the movement and exhaling as they exert force or perform the concentric phase of the exercise. Make sure that they are avoiding holding their breath. Focus on feeling the targeted muscles working throughout the exercise, so concentrating on engaging and contracting the specific muscles that they're aiming to train. And make sure that they're paying attention to any discomfort or pain during the exercise. If they feel any sharp or excessive pain, ask them to stop the exercise, and if they need to, then they can consult a healthcare provider. The 5-point body contact is a term commonly used in exercises performed on a bench or seat, such as the bench press or shoulder press. It refers to the 5 points of contact that the body should maintain with the bench or seat throughout the exercise to ensure stability and proper form. Here are the 5 points of body contact. Maintain the contact between the head and the bench or seat. The back of the head should be firmly supported by the bench or seat. You want to make sure that their upper back is in contact with the bench or seat, and that includes the area between the shoulder blades. Maintain contact between the buttocks and the bench or seat. So the glutes should be firmly planted on the bench. And keep your right foot in contact with the ground as well as the left foot. That's the 5 points. You want to ensure that your foot is flat on the floor and providing a stable base of support. By maintaining these 5 points of body contact, you establish a stable and secure position that helps to distribute the load and engages the appropriate muscles effectively. This position promotes proper form, reduces the risk of injury, and allows for optimal performance during exercises performed on a bench seat. A lot of times you'll see with a bench press that the butt will come up off of the pad. You want to make sure that butt stays on the pad. 5-point body contact position for prone exercises refers to the points of contact your body should maintain with the supporting surface during exercises performed while lying face down. These exercises often target the muscles of the back and posterior chain. Here are the 5 points of body contact for prone exercises. So the forehead, you want to maintain contact between your forehead and the surface you're lying on. Your forehead should be comfortably resting on the surface, allowing your neck and spine to align naturally. You'll notice in this picture on the left that the client is actually looking a little bit forward. I would recommend here that they are looking down at the ground and keeping alignment with their back. Forehead should be comfortably resting on the surface if the bench goes all the way up. Now you can see this one does not. Allow your neck and spine to align naturally. Chest. Keep your chest in contact with the surface. This includes the area from collarbones down to your rib cage. Avoid excessive arching and sinking of the chest. With the hips and pelvis, you want to maintain contact with the surface. Hip bones should be in contact with the surface, providing stability and support. And keep the thighs in contact with the surface as well. Front of the thighs should be touching the surface, allowing for a stable base of support. And the right and left hand, you want to make sure that they are again holding on where they should be as well. By ensuring these 5 points of body contact during prone exercises, you're promoting stability, alignment, and proper engagement of the muscles being targeted. It helps to maintain that neutral spine and distribute the load effectively, reducing the risk of injury and optimizing the benefits of the exercise. Proper breathing technique plays a crucial role in weightlifting and resistance training. It helps provide stability, maintain proper form, optimize performance, and ensure safety. Here are some general guidelines for breathing considerations to keep in mind while lifting weights. You want to exhale on exertion. During the concentric or exertion phase of the exercise, such as when you push or lift the weight, exhale forcefully. This helps stabilize your core, increase intra-abdominal pressure, and provide better support for your spine. You want to inhale on the eccentric phase. During the eccentric or lowering phase of the exercise, inhale deeply and gradually. This helps control the movement and prepare for the next repetition. Determine a breathing pattern that suits you and the specific exercise. Typically, exhale during the concentric phase, where you're lifting, pushing, or exertion, and inhale during the eccentric phase, lowering or releasing the weight. Adjust the timing to match your needs and maintain a steady rhythm. Maintain a natural breathing pace. You want to allow your breathing to flow naturally and avoid rapid or shallow breaths. Deep diaphragmatic breaths can help supply oxygen to the muscles and enhance performance and reduce fatigue. Use your breath as a cue to initiate and control the movement. For example, take a deep breath before starting a lift and exhale as you exert force. This can help synchronize your breathing with this exercise and enhance overall coordination. Remember that breathing techniques may vary depending on the exercise's intensity and personal preference. It's always beneficial to practice and develop a deep breathing rhythm that feels comfortable and supportive for your body. It's essential to avoid holding your breath during weightlifting exercises, as it can also increase blood pressure and decrease oxygen supply to the body. Instead, focus on maintaining a consistent and controlled breathing pattern throughout the exercise. The Valsalva maneuver is a breathing technique commonly used during resistance training exercises that involve heavy loads or high exertion. It involves forcefully exhaling against a closed airway, typically by closing the glottis, the part of the throat responsible for controlling airflow, like you're bearing down. This technique increases intra-abdominal pressure, providing stability and support to the spine and core. This increased intra-abdominal pressure offers support and stability to the spine, enhancing the ability to lift heavy loads, as you can see here in the diagram below. The Valsalva maneuver is often employed during exercises such as heavy squats, deadlifts, overhead presses, where spinal stability and control are crucial. While the Valsalva maneuver can provide temporary stability, it also increases blood pressure and intrathoracic pressure. This can put stress on the cardiovascular system, especially in individuals with pre-existing cardiovascular conditions or hypertension. It's essential to use caution and avoid prolonged breath holding or excessive exertion. The Valsalva maneuver is generally appropriate for brief periods during maximal or near maximal lifts. However, it's not necessary for all resistance training exercises, particularly those involving lighter loads or dynamic movements. For exercises where the Valsalva maneuver may not be suitable or desired, such as exercises with lighter loads for those requiring more dynamic movements, a controlled breathing pattern can be adopted. This involves exhaling during the concentric or the lifting phase and inhaling during the eccentric phase, maintaining a steady and controlled breathing rhythm. When it comes to using a weightlifting belt, it's important to keep in mind some fundamental technique guidelines. Here are some recommendations. Use the belt as a tool, not a crutch. A weightlifting belt should not be relied upon as a substitute for proper technique and core stability. It is a tool to enhance your performance and provide additional support. Focus on building a strong core and using proper lifting techniques first and foremost. Place the belt properly. Position the weightlifting belt snugly around your waist, just above your hips and below your rib cage. Ensure it sits firmly against your lower back and abdominal area. You want to tighten the belt appropriately, so adjust the belt to a snug but not overly tight fit. You should be able to breathe comfortably and maintain proper form while wearing the belt. Reserve the use of a weightlifting belt for heavier lifts or exercises that place significant stress on your lower back, such as squats, deadlifts, and overhead presses. Lighter exercises may not require the use of a belt. Before initiating the lift, take a deep breath and brace your core by expanding your diaphragm and contracting your abdominal muscles. This helps create that intra-abdominal pressure, which the weightlifting belt can help stabilize and support. Even when wearing a weightlifting belt, it's essential to maintain proper lifting technique. So focus on maintaining a neutral spine, engaging the correct muscles, and executing the lift with proper form. If you're new to weightlifting belts, it's advisable to gradually introduce and adapt to their use. Start with lighter weights and gradually increase the loads while using the belt. This allows your body to adapt and ensures that you can still develop strength and stability without relying solely on the belt. Remember, weightlifting belts are not mandatory and their use may vary depending on individual preferences. Spotting is an essential technique used in weightlifting and strength training to ensure safety and provide assistance to a lifter when performing exercises with heavy loads. Some general spotting guidelines: maintain constant vigilance and focus on the lifter throughout the exercise. Be prepared to provide assistance in a controlled and safe manner, using an appropriate level of force if necessary. It's important to note that spotting techniques may vary depending on the exercise, the lifter's experience level, and the specific situation. Proper spotting requires experience and knowledge of the exercise being performed. There are 4 free weight exercise conditions that require a spotter: overhead, for a standing shoulder press; over the face for bench press, lying, and triceps extension; and with a bar on the upper back and shoulders, like the back squat; and with a bar positioned on the front of the shoulders or clavicles, as in the front squat. Any explosive or power exercises should not be spotted. These are the power clean, the hang clean, and the push jerk, as well as the high pull and the snatch. With those particular exercises, you're going to drop the bar. The other exercises, there should be at least 1 spotter and possibly even 2 or even 3, depending upon how much weight they're lifting and what lift they're doing. It's important to communicate with the lifter to ensure clear understanding of spotting cues and needs. You want to avoid excessive interference or touching the lifter unless necessary for safety. If multiple spotters are present, coordinate and communicate with each other to ensure effective spotting. The client should identify when they are going to be lifting off and signal when assistance is needed during a lift. And you can see in the pictures here, the spotters are there, but they don't have their hands on the bar. And the personal trainer should assist the client in re-racking the bar. You might also need additional spotters necessary when the load's beyond the personal trainer's ability to handle effectively. And that is all that we have today. I look forward to talking with you again soon. Take care.